Hello everyone, this is Alim Shah. Hope all are doing well. Today's topic is difference between drugs and medicines. So this topic I have chosen just to make them very clear and understand about the difference because this topic is not only in the PV, usually in the routine life whenever we are working on day-to-day life. There are some interchangeable terms are being used, but as a healthcare professional, everyone might have aware. But since it's a kind of repetition for the new beginners or who is in the entry level of starting their careers. Okay, so here drugs and medicines. So about drugs, usually whenever the term, so actually this particular term is derived from Greek actually, which is called pharmacon. Okay, so actually it meant by pharmacon. And medicines is derived from the term, it's a Latin term actually, medicus or physician. So whatever, it's a kind of treating, so it's more focusing about treating. And these drugs, usually what happens here, take away your control, you know of your mind and body. So this is the one important point, is always this would take away the control of your mind and your body. Okay, but always medicines are focusing to restore your mind and body. So this is very important to understand. And always the drugs would make you to cause addiction, but usually these medicines won't make you to cause addiction usually. But there are some specific medications where it may cause addiction. We no need to talk about that. As a baseline clearance, just we wanted to understand it, always it may cause addiction. Once you take some drugs, it always make you to use it again and again, but in medicines that is not the case. And always these drugs, sometimes it might be some positive aspects, or sometimes it might be a negative action as well, but always this is aimed to provide you only the positive aspects for a therapeutic use. And another simple thing what we can say is, all the medicines or drugs, all the medicines, okay, or drugs, but all the drugs are not medicine. Okay, in order to understand this better, as an example I could say it's a kind of bulk drug. Example, a small example I can say as a paracetamol. I'm not going for morphine, codeine, thebaine, or those kind of example. Just as in paracetamol, you can call them as a drug. If you can take bulk use, misuse, abuse, whatever you want, you can able to make out of it. A simple example. But when this become as a medicine, because you are customizing this particular you know particular API, you can say, particular, which is called acetaminophen. So when you are customizing this particular API into a specific form, that too in a tablet form or elixir or injection, or caplets, whatever the form you are customizing for, particular strength as well as particular formulation in order to give some therapeutic effect on the particular ailments whatever we are targeting for. So you can think this is as a bulk thing, like it's a contain only raw material, it does not have any kind of form or any kind of dosage. Based on the addiction, the people can take, like opium alkaloids also, this can be used as a drug. But when you customize to a particular form where you could able to use this for therapeutic purpose, for severe painkiller for internal organs. So this is the main difference. So the take home message is, always we need to think the take home message whenever we are going to use the term, it would be better to use always medicine. That medicine, have you taken that medicine, have you taken that pill, whatever. But whenever if you are using the term drugs, we should be a bit cautious, because the normal people can use. But even if you can go to check in into the airport, no, I had some drugs, it has lots of difference, you know and no, I took some medicine. So it has lots of difference, it depends upon the where you are talking about that particular terminology, it makes lots of difference. Hope you got some information about the difference between these two. Thank you.